My name is Rigney, and I decided to do my presentation on dementia. So to start, I'm just going to give a general definition and description of the disease. Dementia is an umbrella term that is used to describe multiple conditions or diseases that result in deficits in memory, language, or problem-solving skills. So it's not just a singular disease. It is a progressive disease. It has a slow progression over time, and so it may get worse after the diagnosis. The signs occur when neurons in the brain fail to work properly, and this is due to them becoming detached from other brain cells, and they eventually die off. And so whichever region of the brain those cells were once located in, that's where the deficit will be. The most common conditions that cause dementia are Alzheimer's disease, vascular dementia, frontotemporal dementia, and Lewy body dementia. So first, Alzheimer's disease. This is the most common cause of dementia, making up 75% of the cases of dementia. And it presents itself with very evident memory problems. That is probably the most telling symptom of Alzheimer's disease. But a few other symptoms include the inability to recall names of relatives, difficulty maintaining daily responsibilities such as bills, getting lost or having poor judgment, and repeating statements over and over even after they may have already said them. And Alzheimer's disease may also cause an increase in hallucinations, delusions, depression, insomnia, things of that nature due to the level deficits in the brain. The next cause for dementia is vascular dementia. This cause makes up 15% to 20% of all cases of dementia. And this occurs because of a blockage of blood vessels in the brain. This can be due to injury or disease. But anytime there's a blockage, it could cause vascular dementia. The symptoms are similar to Alzheimer's disease, but they can be separated by difficulty with attention, difficulty with problem solving, as well as difficulty with organization. The third type or cause of dementia is frontotemporal dementia. This cause makes up about 10% of all cases. This is the least prominent type of dementia. And it also has an earlier age of onset, so it would be very rare to see someone diagnosed with this type after the age of 60. As the name states, this type affects the frontal and temporal lobes of the brain, which is the region for planning, social and emotional behavior, as well as all language. And so these patients will have lots of language deficits, along with more of a deficit in personality and speech rather than memory alone. Some of the other symptoms may include inappropriate actions, impulsivity, lack of empathy or sympathy, obsessive or repetitive behaviors, and like I said before, language deficits, speaking, reading, writing, anything of that sort. The last type of dementia that we're going to discuss is Lewy body dementia. This cause makes up 15% to 20% of all cases. It occurs when there are Lewy bodies in the cerebral cortex and the brainstem, and this causes deficits with coordination of movements and thought processing. So these symptoms include cognitive shifts, hallucinations, and Parkinsonism. And Parkinsonism is the most telling sign of someone with Lewy body dementia because Parkinsonism is not seen with the other types. Just some facts about dementia. It becomes more common as people age. However, it is not a normal sign of aging. This is cause for concern if the symptoms are being had. Up to half of all people age 85 or older may have some form of dementia. And worldwide, about 50 million people currently have the disease. And I wanted to also mention that it is possible to have mixed dementia. You don't just have to have one type alone. You can have Alzheimer's disease along with Lewy body dementia. Also, there is no cure for the disease of dementia, but there are many treatment options and medications for patients that suffer from it. For treatment and prognosis, the treatment depends solely upon the cause of the dementia, so each treatment will be different for each type of patient. Obviously, speech therapy is an option for these patients. Speech therapists work a lot with dementia patients, but also it's important to determine if the symptoms that you're having are due to dementia, or if you have another condition that may present with dementia-like symptoms but not actually be dementia, and there could be a cure for that condition or better treatment options. There are drug treatments that are used specifically for people with Alzheimer's disease to kind of substitute for the level deficits that they experience in the brain that affect their memory. These do not cure the disease, but they do help along with therapy. And the life expectancy, as in 2016, was different for males and females. For females, it was 6.5 years, and for males, it was a little over 5 years. Therapy approaches. Therapy is used along with medication to treat patients with dementia. One is not typically used without the other, just to improve the patient's quality of life. The target areas for the SLPs when they do therapy with these dementia patients are attention, memory, problem solving, and thinking skills, because across the board, those are the most prominent symptoms. Some approaches that are used are pictures and words to perform tasks rather than just telling the patient what they should be doing. You could show them a picture of brushing their teeth, using the bathroom, things like that. A second approach is memory books, and these are very useful for helping the patients remember that important information that they may have forgotten, such as their family members' names, what day of the week it is, what month it is, what year it is, anything that may be important for them, such as their birthday or anything like that that they may have forgotten. It is also important to make sure that the family members are trained and that they understand dementia and how to communicate with the individual that's experiencing it. So that's something else that speech pathologists help with. Another very important aspect is making sure that the patient can eat safely. This could include explaining different ways to eat, giving them different types of foods to eat to make sure that everything they're doing is safe. But the main goal for therapy is to improve communication and quality of life for the patient. Lastly, I wanted to talk about the SLP's role in family education, because that is a very important aspect of working with dementia patients. Family members become like other patients to the speech therapist. They need intervention too. It is not just the patient. And it's very difficult to watch someone go through something like dementia, especially if it is your family member. And so it's very important for the SLPs to be open to allowing the family members and caregivers to express their feelings and concerns about the disease and about what their family member is experiencing. And it's also important to keep them well informed, not to sugarcoat anything, but to be straightforward with what their family member is going through with dementia. And it's very important to just put yourself where they are and listen to them and understand them and let them express their feelings and concerns. The two most important aspects of counseling are to teach strategies for interaction, because some family members and caregivers may not know how to interact with someone with dementia. It can be very difficult to learn, and so that is the SLP's job to help them understand how they can interact and should interact with them, and to create a very comfortable environment for the caregivers. They're already stressed, they're already worried about their family member, so it is very important for us to make them feel comfortable. And lastly, this is my personal statement. This just explains why I chose to do my research on dementia. And this is a disease that I didn't really have much prior knowledge about, and that's why I chose to do it, because I know that in my future career, I may be faced with lots of patients that suffer from this disease, and I wanted to become more educated and knowledgeable about it. And I feel as if what I've learned throughout my research, that I will take it with me into my future career. And these are my references. Thank you.